Hi, you guys, and welcome to the channel. My name is London. I am a labor and delivery nurse and have been for many years. I have assisted in over 100 deliveries and have helped women from lower economic status to higher economic status, women who have done C-sections, high birth deliveries, women who have gone unmedicated. So I have a realm of knowledge when it comes to labor and delivery, and also the postpartum phase and also the antepartum phase. And I am here to help you guys make informed decisions, and that is what this channel is for. It is to help educate you guys so that you feel empowered and inspired to make your own decisions when it comes to your healthcare, or partner with your healthcare professionals so that you guys can come up with a plan of care for you that best fits you. I am in no way giving any advice on this channel. I want you to really take the information, learn from the information, but really come up with a plan of care with your particular healthcare professional. So please understand that this channel is not giving any advice to anyone. It is simply my knowledge, what I have gained, and I am sharing that with you to hopefully educate you in some way so that you can make better decisions for yourself. So without further ado, today we are going to be talking about cervical exams. So during the induction process, you will get a cervical exam. Cervical exams are not comfortable. If you've ever had a cervical exam, you definitely already know that they are not the most fun thing and they are not comfortable. So just be prepared for that. And there is multiple cervical exams within an induction process because since we're putting you into labor, we have to make sure that what we're doing is working, because the whole point and reason why you're there is because we want to get you delivered. So cervical exams are usually performed. Now, I want you to pay very close attention to this part. There are things that you need to pay attention to when it comes to a cervical exam, okay? The first thing that you need to pay attention to is, of course, your dilation. This is what most people pay attention to, and they tune everything else after dilation out. And I do not want you to do that. I want you to pay attention to not only your dilation, but the next part of your cervical exam, which is your effacement, okay? Especially in that latent stage of labor, which is an early stage of labor, which is the longest part of labor. You want to pay attention to what your effacement is. And what effacement basically means is how thin is your cervix? How thin is it? Is it 10%? Is it 20%? Is it 30%? Is it 40%? Is it 50%? The effacement can go anywhere from 0 all the way up to 100%. If you're 0, we don't really even give you an effacement. We just say close, thick, and high. That's an exam that somebody may tell you if we don't even know what your effacement is. It's so thick. They may just say close, thick, and high. But if you are effaced, they may say you're 1.5 centimeters, 50% effaced, and -3. Okay, we'll talk about the -3 in just a second. But what I do want you to understand is the effacement is very important. Okay, the effacement is the thinning of your cervix. And in the beginning of labor, that is really what your body is trying to do. It is trying to get your cervix thin. When you come in for an induction, that should really be the goal, is try to get your cervix thin. Because when a cervix is very thin and it's nice and it's thin and it's, it's ready for labor is what I call it, then it will dilate beautifully. But if a cervix is very thick, and thick usually, if you're 50%, 40%, 30%, 20%, you're thick. If you're moving over the 50% hump, you're 60, you're 70, you're like not super thick, but you're like medium, okay? But you're not thin yet. When you're 80% and you're 90%, oh, you're ripening beautifully. Just think of like a flower opening. You're in like, your flower is just like opening very beautiful. When you're in that sweet spot, when you're moving past 70%, you're moving. The thinness is very important. The thinner you are usually helps aid in your dilation. The thicker your cervix is, usually it's a slower process for you to dilate, if that makes sense. So you want to pay attention to your effacement, pay attention to it, pay attention to it. The next part of your cervical dilation is going to be your station, okay? Your station is where the baby is in comparison to your pelvis. And your pelvis is 0 station, okay? Where your pelvis is, that's what we call 0 station. Anything above 0 is negative. So there's -1, -2, -3. Okay. If your baby is -3, your baby is high. That is what we call high. -2, your baby's coming down. -1, your baby's almost at the pelvis. Okay. +1, that means your baby's below that pelvic inlet, which is really good. Usually when you're about +1, you're getting very close to being complete. That's usually when we see you being +1. You're either complete or you're ready to push. Around that time, that's a really good time for you to start pushing and start moving that baby so you can deliver. But usually anything above, when you're coming in for a dilation and you're not in any type of labor, most people are anywhere from super high, we just say high, or you're -3 or you're -2. Most people don't come in at -1, but there are some who do. But most people are -3, -2. So if that is your station when you go in for an induction, that is not abnormal. So until next time, I will see you guys in my next video. And yeah, love you, wishing you the best, the most safe, and the most wonderful delivery. Understand that this is a journey and just enjoy the journey. Bye.